We're now live.
Thank you so much for joining us today. Before we get started, we'd like to begin with a brief message from Gilbert Martinez from our communication staff for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa organizada por la supervisora Hopkins. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos con supervisora Hopkins.
Thank you so much, Gilbert Hopkins, Supervisor for Sonoma County's 5th District and Chair of the Board of Supervisors. Welcome to our COVID-19 and vaccination news briefing for Monday, April 5th. We are still in the red tier in the state's blueprint for a safer economy, and our case rate has actually gone up slightly in the past week. That said, it still looks like we'll be moving into the orange tier, possibly as soon as Wednesday. Dr. Sundari Mace, our health officer, will talk more about that in a few minutes, but we are optimistic that we continue to be on course for reopening our economy and our community. Meanwhile, we actually have some good news to share on the vaccination front as well. As we have discussed before, we have been concerned that our vaccine allocations from the state had remained flat for weeks. Sonoma County had been getting only around 12,000 doses a week to cover both first and second doses. This limited supply was unacceptable to us, especially since we have built a network of vaccination clinics that can now administer 6 times that amount. So on March 27th, the Board of Supervisors appealed directly to the state to ask for an increase in our supply. Well, I'm very happy to report that the state has in fact responded positively to our request. The state will be sending us 1,500 additional doses of the Johnson & Johnson vaccine, which we will be using to continue to prioritize our equity efforts as we distribute the vaccine to our most vulnerable and underserved communities. We are going to be allocating the surge of J&J doses to our 6 federally qualified health centers, which have been among our best partners in maintaining an equitable vaccine campaign. We are also going to be sending 300 of these doses to Cheryl Fox of Fox Home Health, which is working to vaccinate our homeless population as well as homebound seniors. I would like to thank Yolanda Richardson, Secretary of the State Government Operations Agency, who personally responded to our appeal for more vaccines. In addition, we are now expecting to receive more than 17,000 first and second doses in the coming week, which is more than we had anticipated. Dr. Urmila Shende will be talking more about that in a moment. I would now like to turn it over to my colleague, Supervisor James Gore, who can talk more about what he is hearing at the state level in his role as chair of the California State Association of Counties, and also want to thank him for his work in advocating for increased vaccine supply.
Thank you, Chair Hopkins. It's good to be with you right now and also to have some good news on the vaccine front. As we all know, a week ago, well, from last Friday, a week from this last Friday, the board had a good conversation and really staff had also been in a tough situation where we were not only having no growth in our vaccine supply, even though our capacity was so high, but we were having a little bit of a declining allocation. And so, once again, just to kind of rehash what you said, we had sent that letter to the state. We also, on that same Friday, had reached out to Yolanda Richardson, the de facto vaccine czar for the supply side. I had a very good conversation with her and with others about justifying the additional J&J doses. The Pfizer and Moderna doses were pretty flatlined up until then, but they had received more J&J doses. I want to also stress that the J&J doses, the Johnson & Johnson doses, because of their independence from the cold chain, the fact that they don't need the cold chain as much, and because of the fact that it's one shot instead of 2, and not having all of the reservation needs, has become across the state really a vaccine of choice for not only providers but for a lot of the community. There was concern early on by the governor's office and some others about, would this J&J vaccine be seen as a stigma vaccine, like the vaccine for hard to reach communities or the vaccine for homelessness? Well, we've seen quite the opposite. Everybody from all across all different walks are running towards it because of the fact that there's convenience associated with it. So, this idea of us really embracing that demand and making sure that those who are not just the hardest to reach, but they have the hardest time reaching us, prioritize that J&J vaccine. So you think about it. If somebody has to carpool, if somebody lives in congregate housing, if somebody has to take public transit to get a vaccine or whatever, it's dependent upon us, if that's the one in highest demand, to make sure that they have access to that first and foremost. So the idea of us putting this through the federally qualified health clinics and also others is very good. So I want to, just as you did, acknowledge that, you know, the state heard us. We definitely justified it based on the state's metrics. In my conversation with Yolanda Richardson, it was on the state's goal for their, what they call their HPI, their Healthy Places Index, quartiles 1 and 2. That's government talk for the most underserved in our community and where we need to get those vaccines. Many people know that as of, gosh, I think it was this morning on my call, we were within 100,000 doses statewide of reaching the 4 million doses, the goal from the governor's office for the HPI areas, the focus area. We had that 2 million, which really opened up kind of the red into an easier to reach area after the purple tier. And now I know Dr. Mace will go into the other side of it, but this allows the orange tier to open up a little bit more. What else is going on at the state? Well, we got some wording and some verbiage for what happens after the 15th. The 15th of April is when eligibility moves over into anybody over 16. Is also some language on travel and also new guidance for travel, but more so new guidance for events. And when we say events, it's not just outdoor events where people to get together, but things like conferences, meetings, other things like that. And as many people might not be surprised to see, as it does present this scenario where you're allowed to have more events if you can prove that people were vaccinated and or had a negative COVID test before they came to that event. So, some people worry about, does that create kind of two classes of citizens, those who have vaccines and those who don't? But let's call it the way it is, which is it's all, these guidelines that are coming out of the state are all based on safety and transmission and reducing those transmission rates. So I want to thank everybody for working hard on this. These extra 1,500 doses this week by the state, response to our plea for more doses. We hope we'll follow up with another 1,500 doses of J&J next week. We'll follow up on that. But what that allows us to do is make a pivotal swing on our equity work as we move from what I would call the sprint into the marathon. The marathon is what's anticipated in 4 to 5 weeks from now, when we really have more vaccines than we in supply than we have willing people, willing arms, and the needed work that it's going to be to achieve herd immunity and get into communities and really address trust and address information sharing and other things. And just a final call out, I know Supervisor Hopkins, I don't know if you want to say it, but there was a wonderful event this weekend, South Park with the Rice's Collective and Sutter and a lot of other partners that has been lauded as a good success and a model for what we need to be doing going forward. So thank you very much. I'm going to pass it over to Dr. Sundari Mace and more of an update on where we're at. Final plea to the community: if you want to be a part of us moving into these expanded tiers and staying open, not just getting more open, but staying open, be smart, mitigate the risk in your own lives and in your businesses. But number 3, get tested. If we do not get tested, we will not be able to stay open. So I'm going to sign up for a test, and I hope you'll join me.
Great. Thank you so much, Supervisor Gore. And thank you, Chair Hopkins, and everybody else who's participating today. Today, I want to give an update on our case rate and other metrics. After seeing our COVID case rate consistently drop over the past 2 months, we're now seeing a plateau or even potentially a slight increase. This has somewhat stalled our reopening plans. As of today, our adjusted case rate is 4.3 new cases per day per 100,000. And that number would need to be below 4 in the state's current reopening metrics in order for us to move into the orange tier and the basis of this case rate. So we will not likely get there when the new tier assignments are announced tomorrow by the state. Having said that, the state is planning on adjusting the reopening metrics as soon as 4 million vaccine doses have been given in that most disadvantaged community of the lower HPI quartile. As of today, the state has distributed 3.96 million doses to these communities, and the California Department of Public Health officials say it is likely that they'll reach the milestone of 4 million by tomorrow. When this happens, we would only need our case rate to be below 6 new cases per day per 100,000, which it has been easily for the past few weeks. So we'll likely immediately move into the orange tier on Wednesday. While our case rate is important to reopening the economy, it's also a very important indicator of how the virus is spreading in our community. So the increase in cases, even the very slight increase we've seen, is a troubling sign that COVID is not going away. Indeed, it could signal a further wave of cases like the one that's now hitting Michigan, New York, and the New England area. Although our case rates continue to remain low in California, nationwide, there has been an 8% increase in the average daily number of newly diagnosed COVID cases in the previous week. Given that, we'll be closely watching our numbers to see if we have a similar surge in cases after spring break and Easter, when many people may have gathered or participated in other events. In the meantime, this is definitely not the time to lower our guard. In fact, we should continue practicing all of our mitigation measures that have really gotten us quite far here in the last several months. In addition to wearing the face coverings or masks and social distancing, we also need to continue getting tested, as Supervisor Gore just said, so that we can see where the virus is spreading in our community and avoid outbreaks. As we've said before, a good percentage of people are asymptomatic or minimally symptomatic, but they have COVID and they can definitely transmit COVID to family, friends, and the community. So by doing your duty and following mitigation measures and getting tested, you'll be doing your part to ensuring that we don't have that surge, that we stay in the orange once we get to the orange, that we avoid outbreaks. So I can't say it enough times. If you haven't had a test recently, please do go to OptumServe, our state-run testing locations. You can get a same-day appointment at this time. So we have worked really hard this past year to mitigate COVID, and we're really in the cusp of reopening and returning to the sense of normalcy. But we're not there yet. It would be tragic to undo all the progress this close to the finish line. So now I'm going to turn it over to Dr. Urmila Shinde, our vaccine chief, to share an update on the vaccination campaign.
Thank you, Dr. Mace. The biggest news since our last briefing was that the state opened up vaccinations to everyone 50 years and older on April 1st. And while that change slightly strained our vaccine delivery system, we know that in 10 days from now, on April 15th, everyone 16 and older will be eligible to be vaccinated. We're bracing for that date and the demand it will put on our limited supply of vaccine. So we want to stress that just because you may be eligible to be vaccinated does not mean that a vaccine dose will be readily available due to our limited supply. We're still severely constrained by the limited supply we receive from the state. While we've been assured that our supply will increase later this month, it's currently not enough to vaccinate every single eligible person in Sonoma County. So we're encouraging everyone to remain patient until more appointments become available. That will happen very soon. The county continues to prioritize equity in our vaccine distribution strategy. Many of our partner vaccinators are using their supply to prioritize vulnerable, at-risk, and low-income patients to ensure that they're not left behind as we try to get the vaccine into as many people as possible. The county and our network of partners has done an outstanding job with our limited supply so far, and we remain ahead of other counties our size in vaccine doses administered per population. Last week, we crossed the 300,000 dose mark, a significant milestone in just over 3 months. As of today, we've administered 313,102 doses in Sonoma County, which includes 84,871 residents partially vaccinated and 117,600 residents, or about 30% of our 16 and older population, who are now fully vaccinated. 50% of those eligible in Sonoma County have now received at least 1 dose. As Chair Hopkins mentioned, we are now expecting to receive more than 17,000 first and second doses combined in the coming week. And in addition to that, 1,500 J&J doses, which will greatly help with our equity focus. We're grateful to Secretary Richardson and to Supervisor Gore for their advocacy efforts to be able to increase our supply so that we can reach more people. Along those lines, I'm happy to report that the county and our partners held a successful Cesar Chavez Day Health Fair on Saturday in the South Park neighborhood of Santa Rosa. Thanks to Sutter Health, we vaccinated 207 people and took appointments for others. Thanks to Santa Rosa Community Health Center and Sonoma County Medical Association, we vaccinated 100 additional people and also took appointments for more. Health professionals also provided information about vaccines and testing to dozens of people. Many people had their questions answered, their concerns allayed, and signed up for future vaccines and testing. There was positive energy at the event, and with all the collaboration, the coordination, communication, and teamwork involved. This is a great example of how we involve community and worked, and we all work together to get this monumental task accomplished and restore health and hope to our community. We're excited to partner with such community efforts going forward. Thank you to our community-based partners, organizations, including the Cura Project, Raíces Collective, the Hispanic Chamber of Commerce of Sonoma County, Latino service providers, and other groups. So as you can see, we're making great progress, but we have more work to do as we try to achieve herd immunity and expand eligibility to our entire adult population. As Dr. Mace mentioned, we have to continue to be careful to prevent a surge in our community. Please continue to be careful to prevent the spread of any variants in our community before we achieve community immunity. We are so close. So I'm now going to hand it over to Ken Tassif, our mission manager, to review the vaccine stats and data. Ken?
Thanks, Dr. Shandy, appreciate it. Let me just share a couple of charts. This one is an updated chart as of just a few hours ago. And I just wanted to share with you a chart that I show on most of these briefings that shows how we're doing compared to other counties similar sized. And this is all the mid-sized counties in the state. And you can see that this is only a percentage, again, of total vaccines administered compared to total population. But you can see that we're faring very well against comparable counties. And that's a tribute to the really hard work of all our community partners, those that are administering the vaccines out there. Second is something that, and I will share a second screen with you. As of today, you can see that we have hit the 50% mark in terms of percent of eligible population vaccinated, and it's something we're very proud of, and I thought I would point that out. So with that, I'm going to hand it back over to Chair Hopkins, and thank you for your attention.
Thank you so much. And I want to say thank you to Odie and Jordy and Anna for offering translation services this afternoon. And also wanted to remind the community that we will be back on Wednesday afternoon at 5 p.m. to talk a little bit about the move into the orange tier, what that could look like for Sonoma County, as well as changes to event rules and regulations and gathering regulations as well. So thank you all so much for joining us for our live stream today, and take care.